Thank you and welcome to the last but very important presentation of the day. So now in its fourth year, the ARC KSS 2024 poster competition recognises and celebrates research capacity impact in applied health and social care. So researchers throughout Kent, Surrey and Sussex, so health and social care professionals, academics and others were invited to submit a poster, and all the entries were considered by our panel of judges, which was members of the research capacity group, which is called ORCA, which is part of our KSS, the Developing Research Careers Group, and our public advisors. So hopefully you've all had an opportunity to have a look at the posters outside. So we received a record 25 submissions, which is fantastic. So after sort of going through those and looking at and judging those posters, so in the category of pre-doctoral researcher, the winning poster prize is awarded to Daniel. Daniel for the poster, the e-PICS project, how e-health facilitates early detection and care planning for survivors with post-intensive care syndrome. And the judges particularly commented that the poster was visually very appealing, with good graphics, a clearly described research design, with consideration given to research capacity building and generating new knowledge for post-intensive care syndrome. So Daniel, you're just going to say a few words rather than the full presentation. So,
hard work paid off. Thank you. So I just want to give a broad strokes of what the project's about. It's about kind of e-health monitoring in post-intensive care syndrome. So it's people that are discharged from the hospital from after critical care. And for now, as mortality rates drop, but the issue now is more of like, what can we do after you get discharged? And for now, in terms of symptoms, it's more of like physical, psychological, and cognitive. So like maybe breathlessness, fatigue, brain fog, and maybe PTSD from the ICU experience. And for now, according to NICE guidelines, there's a clinic. Not all the critical cares have it, but some critical cares have kind of implemented the recommendations of having a clinic after ICU discharge at 3 months, 2 to 3 months. So my project is more of addressing the current gaps, which is geography, where people aren't able to go to the clinics because they're very fatigued or there's no one that can bring them there. To travel to the clinics are quite far, and also on top of the lack of travel, even the people who attend it, there is a backlog with the NHS trusts that I'm working with in terms of like being able to see all the patients that are referred to the pathway. So in terms of what I'm suggesting is more of can we do a remote monitoring system in the first 3 months to kind of passively monitor the physical, psychological, and cognitive outcomes, and how can that feed into the current pre-existing clinic, and can we detect them earlier, and if they're healthy, can we just take them off it, or if there's early warning signs, can we identify markers in which we can kind of signpost them to the clinic earlier for early intervention. And I think from today's like how it's designed, I think from the talks today from Julian about sustainability, I think the way it's designed, we approach patients and clinicians to see how relevant this project is, as well as how it appeals to the clinicians, because I think one of the issues is more of like, e-health uptake, and especially with the older population. So I think for my project, I want to see if it's feasible to measure the first 3 months, and also, kind of what Jack said in his presentation about, how can we evaluate it, not just quantitatively, but also through the feasibility measures, but also qualitatively, like what works in this, and how can we implement it for, the future, as well as how can we upscale it with more the insight of the population of just to help the uptake of e-health, which is kind of an issue in the older populations that I'm working with. Yeah, so this is just one participant's data. So I think one of the kind of gaps is more exploring the interrelationships of PICS. So I think for PICS, it's mostly seen through a physical domain lens, and there is some psychological interventions that are coming up, but the cognitive side is still kind of underexplored. And so this kind of graph, if you can see it outside, like I said, I don't have a lot of time, but there are some interrelationships that can be potentially explored, and that's one of the aims of the study. So feasibility and acceptability, as well as the potential exploratory interrelationships between the domains. So if I'm feeling maybe my cognition isn't as well, more brain fog, does it affect my mental health? Or if I'm physically fatigued, does it affect my mental health? So there are certain associations that are not yet explored in the field, and that's kind of what I want to kind of contribute within the the future impact of the study. So yeah, little steps, it's a lot, but I think it's more about trying to complete it, and I'm excited to share my results in the future. Thank you so much. Oh yes.
Thank you.
Yes.
Congratulations.
Thank you so much.
Thank you. So, still in the category of pre-doctoral researcher, the runner-up prize is awarded to Kate Day for the poster exploring endometriosis and physical activity engagement. And judges commented on the interesting and important subject matter, good use of graphics, and clear project design. So I think Kate is here.
Hello. Thanks. So yeah, I'm Kate Day, pre-doctoral research assistant at the University of Kent, and I have quite an interest in sort of exploring endometriosis and physical activity beyond I'll get onto that actually. So the background and rationale, it's a condition where tissue similar to the lining of the uterus grows in other places of the body, which can cause a lot of disruptive symptoms. This impacts 1 in 10 people, and there's a huge population. However, historically, women's health has been under-researched, and there's quite a lot of literature gaps. And as we're sort of catching up with research over the last few decades, which is great that there is a big shift towards prioritising women's health research, there is quite a focus on sort of the biomedical model and a reliance on it. However, it's a whole body condition, it's a lifelong condition. The symptoms, there are challenges in terms of symptom management. It can impact with a wider lifestyle, occupation, and physical activity, which is where I'm interested, because physical activity, as we know, is a protective health behaviour for multiple health conditions like diabetes, heart conditions, really important for mental health. And so I wanted to look into, after sort of doing some searching, there's a bit of a gap in understanding how can we support these people through behaviour interventions to promote essentially health longevity, sort of when these people get into later adulthood and later ageing. How can we sort of take a preventative approach to compounding health conditions that may occur? So yeah, I underpin sort of a qualitative study exploring people's current physical activity engagement and looking at their capability, opportunity and motivation, which is the COMBI model created by Mikelyte et al. In 2011, which helps break down our understanding of behaviour. And using a model like this is really useful because we can then identify specific areas and design future interventions to target those particular weaknesses, which comes to my findings. And I didn't quite make that big enough. I should have put less text and more enlarged the symptom. Sorry, I'm just using. Oh no. But yeah, I mean, it's a very short summary of what I've done. It was a very small study itself. So I just wanted to kind of highlight some key findings, and hopefully you can have some time to look at my poster, which describes the findings in a bit more detail. But I think really important things is that a critical barrier, as you can see sort of on this side, is individuals' physical and psychological capability, and that comes from delays to diagnosis, which can essentially initial delays be because of lack of awareness, sort of with healthcare practitioners, sometimes the diagnostic route is a bit complicated and slow because of symptoms manifesting a bit non-specifically. But there were also some really positive things that came out in terms of identifying where we can focus interventions further, and that was sort of knowledge around physical activity. And it was people who did engage in more physical activity had quite a lot of social support and sort of improvements. So they had their social network was really strong. So I think this research can be really useful to inform future research designs, sort of for interventions, and that can be on an individual level, but also I think collaborating with healthcare practitioners, co-designing with people living with endometriosis, and developing more accessible guidelines, as access to information was a really big barrier and struggle for people to inform how they sort of live their lives and how they sort of manage their condition but not worsen their symptoms. So yeah, I have put in a few bids to move this sort of forward ahead and think for the future, and I'm starting a health professional doctorate, so yeah, this will feed into it. Sorry, thank you for your time. Thank you.
Thanks very much, all.
So in the category of postdoctoral researcher, so the winning prize is awarded to Rasa Mikelyte for the team for the poster ASCOT-ER for older people. So the judges commented on the strong, clear design that was very well presented and provides an important contribution to developing the wider use of the ASCOT tool. So thank you, Rasa.
Thank you. Thanks. This is surprisingly embarrassing, being clapped up at the beginning. So as Julie has rightly said, I might be the winner because I'm often the nominee to make posters, but this project isn't a one-woman show. It's a show of quite a few people, but I realized that the writing got cut off, so like, up to you to guess whom. But what's really nice about winning a poster competition is that you get to hear about the project. And I've worked on loads of projects so far, but I think this might be my number one in terms of how nicely it went and how well co-production within it worked. And yeah, it's just a joy. And we submitted everything on time. So I know, right? Gasps in the room. It's been a real joy. But what I want to tell you about quickly is developing a toolkit for older people using social care services who need additional support to self-complete questionnaires. So the usual disclaimer, I won't go over it. I'm sure you're bored and terribly familiar with the format. But what the Easy Read Toolkit is, known as ASCOT-ER for older people, it's part of a suite of toolkits that help people who are supported by social care services to express how they're finding those services, whether they're having an impact on their quality of life and what the quality of those services is. And you'll see the domains that it measures. So it looks at control over daily life, personal cleanliness, cleanliness of your home, food and drink, personal safety, many aspects of what living well for people is. I've already hinted at that there's a whole variety of ASCOT tools. There are self-measures, there are proxy measures for people, for example, who can't self-complete anymore, not even with help of aids such as talking mats, that's yet another version, but who might need a proxy of, let's say, a family member or a carer or supporter to complete it for them. But we've also known that there's this middle ground of people who might be living with mild cognitive impairment, mild to moderate dementia, who might be able to complete a questionnaire if only that questionnaire was more accessible, if only it was more inclusive of this group of people. the ASCOT suite already had a tool for adults with learning disabilities, but we felt it, and perhaps anyone in the room who's worked with both populations will know that different rules apply in terms of what works, in terms of what accessibility is. So we felt it in our bones, with a couple of references, that that might be the case. And thankfully, NIHR RFSC funding body agreed too. So we got the project funding and off we went to design. And what we did, instead of waffling about specific methodologies, is we iterated a great deal at how we did it. So first we brought that original tool designed for people with learning disabilities, showed it to a group of older people, more than half of whom had a diagnosis of dementia, some had visual difficulties, etc. We showed the tool and asked, how do we make this so it suits you? After we've done 3 rounds of this kind of doing what we're told, bringing it back, seeing if it works better now, and sometimes when you see it on the page, actually doesn't anymore. After we've done 3 rounds of this, we started in between taking it for cognitive testing. So very specifically here, to people who were living in the community, who had a diagnosis of dementia or cognitive impairment, and who were drawing on social care services. And again, we kind of iterated those steps to further and further improve and bring back our findings back to the working group. But instead of listening to me, I'd like you to listen to the people who were part of this work and hope that it works. This is what working group members said about being part of this project.
I enjoyed the twists and turns of the research. That's been, for me, a new experience and a really pleasurable one as well. Yeah.
Very interesting. To see how a project is developed, to be involved in a project, meeting other people.
I thought it was interesting seeing how much work goes into producing and changing questionnaires and worksheets. I didn't realise that the whole process was so lengthy, so that was interesting.
I liked the way in which the group worked together, bouncing ideas off each other. It doesn't always work, but it did really work very well with this particular group. And I think it was very creative. It taught us, each of us, I think we learned something from somebody else's perspective.
It saved my life. It made me look, I have Alzheimer's, and I thought it was the end of my world. But I've just realised it's not. This is just the beginning of a different world. And coming to this was the first step of that. And it's been really life-changing.
I think those who receive the toolkit it would be wise for them to know that it was constructed in conjunction with people who have a diagnosis of dementia. And in fact, the contributions of those with dementia were fundamental in what that person is receiving.
If Dawn hasn't made you cry or just well up a little bit now, there's QR codes on the slides and on the poster. Watch the full videos. I'll take bets on whether you'll sob or not by the end of it. But what we ended up with was quite a changed format of the questionnaire. And we know that there were things that, for example, you'll see we started with pictures. Those pictures didn't suit anyone in this group of people. We used different pictures. This is the food and drink item. And then cognitive testing showed that the pictures were a distraction. They weren't actually used in a way that was helpful. They were either just there or they were actually distracting. And if, as researchers, we were just let off to do it on our own, we would have stuck to the pictures because surely a picture is helpful, right? That's kind of what we're often taught. And what the co-design process has shown us is actually not. And you'll see that the version is stripped down quite a bit from even the previous easy read that we had. You're welcome to download the tool and look at the other changes we've made, but that's one example of how it looks now. And so we're hoping that this, because the team have been asked so many times about, is there something for this group of people? Can we use this tool that you've got for people with learning disabilities? And we kind of said, no, not really. That now more people will be able to complete the questionnaire by themselves. We know that proxy measures are helpful, but they're not the same as the opinion of the person receiving support. And what we're already really happy to say is that the British Red Cross, before we even had the final version, were really interested in using the toolkit. So it has been licensed for their free use with 10,000 older people that they support. So we're about to see how effective the toolkit is in the wild beyond our cognitive testing group. Thank you very much. You can watch full videos and have a sob. Good for processing emotions. Thank you very much for listening.
Thank you very much.
Thanks, Teresa. So, still in the category of postdoctoral researcher, the runner-up poster prize is awarded to Dr. Devon Glass for the poster Co-Designing Guidance for Inclusive Personal, Social, Health and Economic Education with and for Autistic Young People. Judges commented that the poster had a really clear design with lovely use of graphics in an important area of study, which extends health and social care education. Unfortunately, Devon is unable to be here this afternoon as she's presenting at another conference in demand, but we'll be sure to pass on the certificate to Devon. And then, Devon. And also in the category of pre-doctoral researcher, the judges would like to give a highly commended award for the poster, the Kent Youth Research Networks. So judges commented it was a great poster, visually interesting and impactful for a project that gives a voice to young researchers. So highly commended, Hannah Patton.
Oh yeah, that's fine as well. Yeah.
I have to say, is it possible for me to have one that actually has my admin Charlie's name on? Because the poster was not, it wasn't really me. I drew it out on some flip chart, and it was really just a test of Charlie's patience of the design and then me changing it. So is it possible?
I'll
send one for Charlie. Yeah.
Thank you. And finally, so thank you all for coming along to the Viper presentations and also for voting in the little black box for Vipers. So we're really pleased to announce the winner of the Viper competition is Julian Middleditch. As voted for by all of you. So.
Yeah.
That's all right. Thank you. And we'd like the prizes. So the runner-up prize goes to Jack Barrett.
Thank you very much. Yeah, excellent. Thank you. Good.
We've worked you today, Jack, haven't we? Really? And we couldn't go without really saying thank you to our other Viper presenters who came along. So also, small awards for Innie Afolayan. So thank you very much, Innie, and also to Lee Yates. So congratulations to all our prize winners and also to all of those who submitted posters to the competition. We had such fun, well, as you've all seen, such fantastic, wide-ranging posters. So thank you all for your contribution to that. So yeah, thank you. I think we'll hand over to Sally next. And hand over to Sally for closing remarks.
Well, doesn't the day go fast? You know, we've been building up to this symposium for quite a long time now, and we've, the team in the ARC have done fantastic work to get this to happen today, and I'm really grateful for all of their support. But really, it's about you all taking part so actively, and I think we've seen such a range of things today, haven't we? The posters have just mentioned, such a range of topics, methodologies, ways of doing things, engagement with the public. There's so much in those posters, and thank you all for those contributions. The keynote papers today, I think, have been really stimulating. Thank you, Rachel, for your journey. That was so interesting and I think made us feel so proud as well within the ARC to see, one of our first PhD students go through all the way through to a postdoc position, and really a lovely example of what we aim to do in terms of capacity development. So thanks for that. And we had, that wonderful talk about growing health together this morning, and the way that neighbourhoods and everybody can work together to build preventative models and to really support and improve people's health and well-being in the community. Wonderful. And then we've also heard from the Children and Young People's workshop, how to engage with young people in research. And that's been such an important part of the whole of the ARC, the co-design element. And we had some special funding, as you probably know, to allocate to children and young people. And that was one of the things that we did to set up the youth partnership groups. And so that was a great workshop, and thank you to everybody who's contributed to that, and to the comms workshop, and to the research journeys. Everyone has made really great contributions today, which has given us all the opportunity to learn. That I always learn something new whenever I come to these kind of events. So we've all had a chance to network and share and learn something new. So I think going forward, I said this morning that, what we want to do is to do better things better. And I think going forward, we have such a great foundation for doing that. We're already doing great things. We can do them better. We can do better methodology. We can do better publications. We can do better designs. We know how to win grants. We're seeing more and more of that happening within the ARC. And we can work with each other even better than we are now. We can build those collaborations, those partnerships. We can work with and engage with our public partners, with those young people, with the people that we've just heard about who have dementia, Alzheimer's. They want to be involved. We can do that even better. We can support each other even better. We have a mentorship program. We can make that a better program. So we have lots of work still to do. We can't sit back and think, ARC, done, tick. We have more to do, and we will do it. But I think really the aim of today has been met. We've brought people together, we've networked, we've shared, we've discussed our research, discussed different ways of doing things, and I'm just really glad you could all be here in person, and we're getting back into that, what used to be normal, and we've had 4 years of it being not the norm to meet in person, but now we're back in that space, which is also wonderful. So thanks all for coming and for taking part so actively, and for helping us all have such a great day.